there are two types of vettings generally. There are a few others, but the two types of vettings that one is normally asked to perform are 2-stage and 5-stage vettings. And people sometimes don't really understand what the differences between those two are. The 5-stage is your standard vetting. So that is the vetting that should be performed on most horses. The 5 stages are the physical exam. So that's where we look and run our hands over the entire horse. We listen to their heart, we listen to their lungs, and we look in their eyes. That's the first stage. The second stage is where they're walked and trotted in a straight line, and you perform the flexion tests. Flexion tests are very controversial, but they are an essential part of the vetting, and they must be performed unless you can't do so because the horse is unable to be flexed. Maybe they're too young or whatever. So that's the second stage. The third stage is where the horse is then ridden. So the horses are ridden really for 3 main purposes. The first is to see, are they lame under saddle? Some lamenesses are only seen under saddle, not when they are walked and trotted in a straight line or lunged. So their first is for a gait analysis, so are they lame or not? The second is to get the heart rate elevated, because some heart defects, murmurs, etc. only present themselves once the heart rate has actually gone up. So that's essential for us to fully check out the health of the heart. And the second is their wind. So have they got a normal airflow through the larynx? So we can see whether there's a future problem with the air. So they're the 3 main things, the gait being the most important of all of those. Your 4th stage is where the horse is rested. So that is to allow the horse to stiffen up, in inverted commas. During that process, we tend to look at the passport maybe, or identify the horse, and just let the horse, cool down and stay either in the stable or just stood as we are now. That's perfectly fine. And then there's the final stage, and the final stage is where the horse is trotted in a straight line again to see how sound they are. We then back them up to see if they back up properly, and then we also turn them in a tight circle on both reins so they cross their legs. And then if that is okay, we then lunge them on a hard circle. Regrettably, that is probably the area where we most frequently identify problems. It is a very harsh test, there is no question about that, but it's an essential test. If you brought a horse here for a lameness examination, the area that we will find most lamenesses is when we put them on the hard circle. So it's a very important thing. Owners of horses are understandably quite nervous about that because they don't want the horse to fall over, and we don't want to make the horse sore. So you don't want to do a lot of lunging on a hard surface at all. You do the minimum you possibly can to fully assess the gait. And if we get to the end of that, hopefully we then have a happy story and we have a horse that has passed the vet. You've got your new horse and everybody's very happy. 2-stage examinations are basically where the horse is not ridden, so they don't actually have the time to stiffen up, and they don't have the second trot up. So in the 2-stage examination, you would have a full physical examination, including listening to the heart and the lungs and looking in the eyes. The horse is then walked and trotted up in a straight line, and the horse is then has a flexion test of all 4 legs, and then they're lunged on the hard circle. It's a much more compressed examination. You do identify a lot of stuff. You sort of do all of the important things, as it were, but you certainly will not identify everything that you possibly could do. Sometimes you can only do a 2-stage examination because the horse hasn't been broken, or there's no one to ride the horse, or something like that. Then or it's too young. Then there are reasons to do that. Sometimes people know the horse very well, so they've either had the horse on loan for a prolonged period of time, or they've known the horse for many years themselves, and we are just performing an examination to identify stuff that they themselves couldn't identify, the eyes and the heart, etc. And there are a few other types of vettings. There's mortality and there's insurance as well, but they're sort of slightly different. But the 2 main things are your 2-stage and your 5-stage.